Welcome back. So Deputy President Paul Mashatile says the country is still battling one of the highest HIV and TB burdens globally, despite progress in reducing new infections and improving access to life-saving drugs. He made the comments at government's official World AIDS Day commemoration at Sisa Dukashe Stadium in Mdantsane. Newzroom Afrika's Sipha Kema has more from the Eastern Cape.
While South Africa has made remarkable progress in tackling the HIV epidemic, the fight is far from over. TB remains the leading cause of death.
Our country remains the epicenter of HIV and is among those with the highest TB burden. There are nearly 8 million people living with HIV and TB. And TB remains the leading cause of death, claiming around 56,000 lives every year.
The government is prioritizing preventative measures, including the rollout of injectable HIV treatments. These new interventions are key to curbing infections and improving patient adherence.
Through the National Strategic Plan, the NSP, which also calls for a whole-of-society approach. It recommends the introduction of new injectables for HIV prevention and treatment in the country's HIV program. Program directors, South Africa is among countries in sub-Saharan Africa that has made significant contribution to the global body of knowledge on HIV prevention, as these HIV injectable medicines were tested in this country.
Despite advancements, SANAC reports that over 1.1 million South Africans remain off treatment, posing a challenge to meet the global 95-95-95 targets. The government is intensifying efforts to trace these individuals.
The problem here, as I said, are men and children. The people we need to find and put on treatment are men and children. Out of the 1.1 million people who still have to be on treatment, more than 600,000 are men who are looking for. And we think we can win that battle if we found them.
The Eastern Cape Premier says despite progress in reducing infections and AIDS-related deaths, societal challenges hinder further success.
With the indications we have since 2000, the statistics shows that we have been reducing the HIV infections by 64%. We have also experienced a significant decline in AIDS-related deaths here in our province by 54%.
Global partnerships, including PEPFAR, continue to play a critical role in South Africa's fight against HIV.
For this current implementation year, the U.S. government through PEPFAR has invested $439 million, which is around, roughly, depending on the exchange rate, around 8 billion rands. And so that's just for this one implementation year. The amazing thing about the partnership with South Africa is that we've been here in South Africa working closely with the government, different institutions for the past 20 years, actually about 21 years. And during that time period, we've invested close to 154 billion rand.
Mashatile emphasized that ending HIV infections by 2030 is achievable if South Africans follow health recommendations and adhere to treatment protocols. For Newzroom Afrika on Channel 405, I am Kema at the Sisa Dukashe Stadium in Mdantsane.